31,000 years ago, in a limestone cave in what is now Indonesian Borneo, a young person was missing the lower part of the left leg. The cut had passed through the tibia and fibula above the ankle. There were no hospitals, no steel instruments, no antibiotics, no ambulances waiting beyond the cave mouth. A wound like that could have killed within hours or days. It did not. When archaeologists examined the bones, they found a new bone had grown over the cut surfaces. The injury had healed. The person lived at least 6 to 9 more years, then was carefully buried in the cave. The skeleton is known as TB1, and it forces a surprisingly uncomfortable question. When someone in the deep past lost an arm, a hand, a foot, or part of a leg, were they simply finished? Sometimes, almost certainly, they were. A lost limb is not one problem. It is several problems arriving at once: bleeding, pain, shock, exposure, infection, hunger, thirst, immobility, and the danger of being left behind when everyone else has to move. In a small mobile group, an injury could turn a familiar hillside, a river crossing, or a patch of forest into a barrier. Yet the bones tell a more complicated story than the old image of prehistoric life as a place where every weakness meant instant death. Some people did survive terrible injuries. Some lived long enough for broken bones to knit, infections to subside, joints to change shape, and muscles to adapt. A few skeletons preserve something more revealing than the injury itself, proof that a person had time. That distinction matters. Death leaves a body. Healing leaves a record. A fresh fracture has jagged edges. A healed fracture begins to smooth over. Bone is living tissue. It responds to stress, loss, and repair. When a limb is lost and the person survives, the remaining bone can remodel. The surface closes. The shape changes. Nearby bones may grow thinner from disuse, while the other side of the body takes on more work. Archaeologists cannot watch the original event. They cannot hear the voices around it or know who carried water, but they can see whether a body was given enough time to continue living. TB1 is one of the clearest cases ever found. The lower left leg was removed with a clean, slanted cut through both bones. The pattern does not look like a leg crushed by falling rock, torn away by an animal, or mangled in an ordinary accident. The researchers who studied it concluded that it was a deliberate surgical amputation, probably performed when the person was still a child. The left leg later failed to grow normally, and the bones show long-term limited use. The right leg also suggests that walking was difficult. That is a brutal image to hold in your head. A child with a severely damaged lower leg in tropical Borneo, surrounded by wet ground, insects, dense vegetation, and every kind of wound contamination that modern surgery is designed to control. The person survived the cutting. Then they survived recovery. Then they survived years after recovery. The archaeological evidence does not tell us exactly how. We do not know what cutting tool was used. We do not know whether pain was managed, what was placed on the wound, whether someone controlled the bleeding with pressure or bindings, or how many people were involved. We do not know whether the procedure was attempted after an accident, a disease, or an injury that had become impossible to save. We should be careful with the temptation to turn a few bones into a complete operating room. Still, the outcome says a great deal. The wound did not show the bone changes expected from an uncontrolled infection. The cut healed. For that to happen, somebody had to understand enough to remove damaged tissue without immediately killing the patient. And then enough people had to keep that patient alive afterward. The procedure was only the beginning. In the first moments after losing a limb, the body faces a race against blood loss. A major vessel can turn a traumatic injury into a crisis very quickly. The person can also go into shock. Not the dramatic movie version, but a dangerous collapse in the body's ability to circulate blood and maintain its normal functions after severe injury. Even when the bleeding slows, an open wound can become an entry point for bacteria. Before modern antisepsis and antibiotics, infection could turn a survivable injury into fever, tissue damage, and death. Then comes the part that can last for months. A person with a lost foot cannot simply stand up and return to the same routine. A hunter cannot move across rough ground in the same way. Someone gathering tubers, carrying wood, climbing a rocky slope, or keeping up with a camp on the move faces a different map of danger. Every trip to a stream costs more. Every wet night makes the body work harder. Every predator call in the dark has a different meaning when running is no longer an easy option. Survival would have depended on more than toughness. It would have depended on other hands. Someone had to bring food close enough to eat. Someone may have had to carry water. Someone had to make space near warmth and shelter, keep a wound from being bumped, and help the injured person move when the group relocated. That does not require a sentimental story in which everyone became a saint. Small groups can help an injured member for many reasons: kinship, obligation, affection, reciprocity, practical value, custom, shared risk, or a mixture of all of them. The important point is simpler. Long-term recovery is rarely a one-person achievement. Modern people often picture ancient survival as a contest between one body and nature. A lone figure with a spear, a storm, a wolf at the edge of a fire. That picture is visually powerful, which is why it keeps returning. It is also incomplete. Humans survived because groups could pool food, pass on knowledge, watch children, tend fires, make tools, remember seasonal routes, and change the pace of travel when one person could not keep up. Losing a limb made those relationships visible. A severe injury could reduce what a person did, but it did not erase everything they could do. A person with one damaged leg might still shape stone while seated, prepare food, work hide, sort materials, watch a fire, teach a child, or contribute knowledge about a trail, a plant, a water source, or an animal's behavior. They might take on none of those roles. They might have needed extensive help. The bones cannot give us a job title. That uncertainty is worth protecting. For a long time, stories about prehistoric disability often went straight to a dramatic conclusion. If a person survived, they must have been carried by a compassionate tribe. If they were injured, they must have been useless. Both ideas flatten real human lives. Disability does not automatically mean helplessness. Care does not automatically mean that every group behaved the same way. A person can adapt creatively, contribute in ways that leave no archaeological trace, and still need meaningful support from others. The past does not give us a neat choice between independence and dependence. It shows how often the two are tangled together. The Borneo case is extraordinary because it documents a successful amputation so early. It does not mean every foraging group had a surgeon, or that limb removal was common. The researchers themselves cannot say whether this was a rare event or part of a larger medical tradition that simply vanished from the archaeological record. Bone preserves badly. Soft tissue almost never survives. A successful operation can leave a clean, healed signature. A failed attempt may leave no skeleton at all, or no evidence that anyone can recognize thousands of years later. That bias matters when we ask how often people survived. Archaeology is much better at finding the long survivors than the people who died before their injuries could heal. A person who bled to death in a floodplain, was scavenged, or was buried in soil that destroyed bone may disappear from the record. The healed skeleton is the exception that can speak, so the honest answer is not that ancient people routinely survived limb loss. Many probably did not. The honest answer is that the possibility of survival existed much earlier than old stereotypes allowed, and some communities possess the knowledge and social capacity to make it happen. There is another famous example, although it is more complicated. At Shanidar cave in what is now northern Iraq, archaeologists found the remains of a Neanderthal man who lived roughly 45,000 to 35,000 years ago. He is called Shanidar I. His body carried a long history of trouble. He had a major injury to the left side of the face that may have reduced his vision. His right arm was severely withered, and the forearm and hand were absent. He had an abnormal gait, evidence of joint problems, and serious hearing loss. The image is almost overwhelming. A man moving through Ice Age terrain with impaired hearing, limited vision, a damaged arm, and a limp. Shanidar I lived into an age estimated at roughly 35 to 45 years, unusually old for a Neanderthal in the archaeological record. His injuries had healed rather than killing him. For decades, he became one of the central examples used to argue that Neanderthals cared for vulnerable group members. The broad idea is reasonable. It is difficult to look at the full combination of Shanidar I's injuries and imagine a life entirely without assistance. His hearing problems alone would have made it harder to locate sound in a landscape full of wind, water, animals, and other people. A missing forearm would have changed tool use, carrying, balance, and defense. A limp would have made long movement more costly. But even here, the details are not as simple as they sound in a documentary. The missing forearm does not prove that Neanderthals deliberately amputated it. Researchers now treat intentional surgery in this case as inconclusive. It may have resulted from trauma, disease, or a long process of tissue loss. Nor does a wounded body prove that a person spent every day unable to contribute. People learn to use one hand. They change how they grip, carry, brace, kneel, sit, and work. One modern danger in reading ancient skeletons is assuming that a damaged body must have been a passive body. Shanidar I may have received substantial support. He also may have adapted in ways that are invisible to us. Those ideas can coexist. That is one of the most useful lessons in these ancient cases. Survival after limb loss was not a switch flipped by either individual strength or group care. It was a moving arrangement. Some days a person could do more. Some days pain, terrain, cold, or illness could make help essential. A group could change tasks. An injured person could change technique. The same hand that could not throw a spear might still scrape a hide. The same person who could not walk far might still know where a herd crossed a river in late summer. Knowledge is easy to underestimate because it does not fossilize. Imagine a band preparing to move camp. There are baskets, stone flakes, sleeping children, bundles of hide, embers protected in ash, and a rut to remember. An injured adult may not be carrying the heaviest load, but neither does every healthy adult perform the same task. Human groups have always worked through variation: age, skill, strength, attention, memory, pregnancy, illness, and experience. A limb loss would have changed that balance. It would not necessarily have ended a person's place in it. Of course, this is not a comforting story in every case. Pain was real. We should not scrub it away because the ending is inspiring. A limb lost in an accident or removed to survive a damaged wound could mean months of agony, vulnerability, and fear. There were no standardized crutches, rehabilitation clinics, or pain medicine with measured doses. Some people may have lived with exposed bone, chronic infection, contractures, or an altered gait that gradually damaged the rest of the body. A person could survive the original injury and still die later from its consequences. And even successful survival had a cost. The Borneo individual's remaining leg shows signs of reduced use, and the body was probably much less mobile than before. A person who had once run, climbed, and crossed uneven ground freely may have become cautious around every slope. There is no reason to pretend ancient groups could restore a lost foot. They could not. What they could sometimes do was turn a catastrophic injury into a life that continued. That change is easy to miss because we are used to thinking of medicine as a room full of machines. In the deep past, survival care may have looked less dramatic. A drink placed within reach, food cooked soft enough to eat, a fire maintained through rain, a sleeping place away from trampling feet, a hand offered during a river crossing. a camp waiting one more day. Those actions are small. Repeated over weeks, they become medicine in the broadest human sense. There is a temptation to call every ancient example of care proof that our species had already discovered kindness. Maybe it is. Humans are capable of attachment, grief, generosity, and sacrifice. But archaeology cannot directly read emotion from a healed bone. It can show that somebody survived a condition that likely required accommodation. It can show deliberate burial. It can show that an injured body remained within a social world rather than vanishing from it. Why people helped is harder to know. Perhaps a parent protected a child. Perhaps siblings shared food. Perhaps a skilled craftsperson was too valuable to lose. Perhaps a group followed rules of mutual obligation because anyone could be injured next. Perhaps care was woven so deeply into daily life that no one stopped to name it. These explanations are not mutually exclusive. In a dangerous landscape, helping another person can be both deeply personal and practical. Today's injured child can be tomorrow's expert tracker, food processor, storyteller, parent, or source of hard-earned knowledge. Even in a harsh environment, abandonment is not always the most efficient strategy. Humans are unusual in how much we depend on each other across long stretches of life. Babies need years of care. Older children learn through watching and doing. Adults survive illness, injury, pregnancy, and food shortages, partly because other people compensate. A group that could redistribute effort when one member was hurt might have been more resilient than a group where every person had to remain physically identical and constantly productive. Limb loss makes that logic impossible to ignore. It also changes how we think about prehistoric medicine. People often imagine that medical knowledge begins with cities, writing, metal instruments, and formal specialists. Those things transformed medicine without question. They made it possible to preserve techniques, build institutions, and eventually develop anesthesia, germ theory, surgery, and antibiotics. But knowledge about the body did not appear out of nowhere when cities did. Foraging communities had watched wounds for countless generations. They had seen cuts heal, seen them rot, seen people bleed, seen swelling, fever, and recovery. They knew animal bodies through hunting and butchery. They knew which places on a limb were dangerous to cut, even if they did not describe blood vessels in modern anatomical language. They knew which actions made survival more likely because somebody had tried them before, remembered the outcome, and taught someone else. The Borneo amputation does not show modern surgery hidden in the Stone Age. It shows something more interesting. Practical expertise developed under conditions where mistakes were expensive. The person who lost the lower leg was not rescued by a magical prehistoric hospital. They survived because technical skill and sustained care met at the same moment. A clean removal alone would not have been enough. A loving family alone might not have been enough if the wound kept bleeding or became infected. Survival sat at the intersection of knowledge, attention, labor, and luck. Luck deserves a place in the story too. Two people can suffer similar injuries and have different outcomes. One wound misses a major vessel, another does not. One happens near shelter, another happens miles from it. One person is injured during a season of abundant food, another during drought. One group has the time and resources to slow down. Another is fleeing cold, conflict, or hunger. One body fights infection successfully, another cannot. The archaeological record gives us survivors. It does not let us calculate the odds. That is why a healed limb should never be treated as evidence that the past was safe or that ancient people had pain under control. It is evidence that extreme survival was possible. It is evidence that the old assumption, injury equals inevitable abandonment, was too crude. The answer also depends on which limb was lost. A missing finger could change grip and fine work without stopping walking. A damaged arm could make throwing, climbing, carrying, and defense difficult while leaving a person mobile. A lost foot or lower leg could reshape every trip across the landscape. An injury higher up the leg could be even more limiting. And the age of the injured person mattered. A child had years to adapt to a changed body, but also depended heavily on adults. An older person might have had more knowledge and status, but a slower recovery. There was no single ancient experience of amputation. Some injuries happened suddenly. A falling tree, a stone collapse, a hunting accident, a predator encounter, an infected wound, or frostbite could all threaten a limb. Other limb changes may have followed disease or long-term damage. We cannot assume every missing bone came from one dramatic event. Bones do not preserve the sound of the accident. They preserve the aftermath. That aftermath can be deeply human. A healed stump means someone protected a wound long enough for the body to cover it with new bone. A changed gait means a person kept moving after the body's old balance was gone. A deliberately placed burial means that when life ended, somebody dealt with the dead in a way that required attention. None of this turns the past into a warm, gentle world. It makes the world more recognizable. People suffered. People depended on others. People adapted. People sometimes made room for a body that no longer worked the way it once had. There is a modern instinct to admire the survivor as an isolated hero. We want the story to be about grit. The ancient evidence points somewhere less individualistic. Grit may have mattered. So did a group that could keep a fire alive, divide food, remember routes, alter routines, and decide that an injured person was still worth the effort. The person in Borneo never tells us their name. We do not know their voice, their family, or the reason their leg was removed. We do not know whether the people around them were frightened, skilled, grieving, hopeful, or all of those things at once. We know that a lower leg was deliberately removed. We know the bones healed. We know the person lived years beyond the injury. We know the body was later placed in a grave inside a cave. Across 31,000 years, those facts are enough to overturn a simple story. Losing a limb in the ancient world could be a death sentence. For some people, it probably was. But for others, the loss marked the beginning of a different life. Slower, more dangerous, more dependent in certain moments, and still connected to a group that could make survival possible. The healed bone from that cave is a quiet record of all the days after the injury. The water brought close, the food shared, the fire tended, the path adjusted, the waiting, the work of keeping one person alive long after the moment when nature seemed to have taken something essential away.